Hello, Heritage Todd Creek. I am Dr. Sam over at Live Your Life Integrated Health and Chiropractic. Typically, we do our HTC talks once a month on the second Monday, but due to quarantine, we're going to do it this way instead. So let's get started here. Today, we were going to do 4 frequently asked questions, but we're going to go over just 2. Keep it a little bit shorter and sweeter this way. And if you do have any questions for after the presentation, we have our email and our phone number listed down here below. And I think I can even point that out. So we've got our email and phone number. So if you do have any questions, please feel free to contact me. We'll be happy to answer as best as we can. So our first frequently asked question kind of pertains to 2. Why can't I fall asleep at night? Why can't I stay asleep at night? So the 2 main issues with sleep are that people we either 1, can't fall asleep or we can't stay asleep and we end up waking up again and again throughout the middle of the night. This is a problem in tons of people. I would say at least 80% of my patients have this issue once a month. At least half of my patients have this once a week. And unfortunately, some of my patients have this almost every night. And of course, this is going to lead to a lot of side effects if we aren't sleeping well. Especially right now, sleep is one of the best ways to promote our immune system to stay healthy. So we want to make sure that we are getting good sleep. 3 of the big reasons that we don't get great sleep is stress. That's probably way up there with diet. Those are the 2 biggest ones, stress and what we eat. And the 3rd is activity levels. And we have our cortisol levels, which is what we're going to talk about on this slide. So if you have heard of cortisol before, it is our stress hormone. That's what it is typically known as. And it helps modulate us when we are too stressed out. It doesn't let different blood levels get out of control. So it can be very helpful short term, but we don't want it to have long-term side effects. If it gets too high or too low for a long term, we are going to have issues. And what this is showing here is how closely cortisol is related to time and our sleeping patterns. So over on, let's do blue, this side of the screen, right, we've got 8 a.m. So we're starting our day. And over at this side, which I think my face is a little bit in the way, but we are at midnight, 4 a.m., and then over on this side, we're back up to 8 a.m. again, okay? So we're supposed to start off the day really high in cortisol. The blue curve is what shows what a normal curve should look like. We should have very high cortisol, 8 a.m. That's going to help wake us up, wake our brain up, wake our body up. We're going to get up feeling fairly refreshed. It's going to drop down pretty quickly, and by midnight, it's going to be typically at its lowest. And then we're going to have a sharp spike around 4 a.m., somewhere between 3 to 5 a.m. typically. And as it gets really high, spikes really high, that's when we're going to notice us waking up. That's just our body awakening again. Now we can have a few different curves as well. So we have our reverse curve, which is in the orange. And this is oftentimes people that can't fall asleep at night. So we see they have a very low at 8 a.m. They're half of what they should be. All right. So they have a low cortisol curve, drops down pretty quickly, but not as far as the normal curve. And then it's actually going to go up. And so these people are going to be really awake 8, 9, 10, midnight. They're going to actually feel the most awake. It's because their cortisol curve has completely turned around. And all of this is going to take some training to turn that cortisol curve back around. These abnormal curves, the green one that you're seeing here, are often the people that wake up in the middle of the night. So we see they kind of start off normal, not quite all the way up. And then somewhere in the middle of that night, they're going to have a peak that's going to drop down again. And that peak and that dropping is going to be enough to wake the body up for a lot of people. And so especially if you're waking up at the same time every night, I have some patients come in and they say, nope, 2 a.m., I am awake. 4 a.m., that is, I can look at my clock and almost set my time by waking up at that time. We are often having that cortisol curve spike right around that same time every single night. So we can see how important cortisol curves and what our cortisol levels are to us getting a good night's sleep. Let's see here. So if we had less stress during the day, if we ate healthier food, if we were more active throughout the day, a lot of this could easily be fixed on its own, but some of these can be really hard to accomplish. People don't very willingly give up their carbohydrates. Telling someone don't stress usually makes them stress more. So some of these things can be very hard for people to actually accomplish. So what can we do to help restore our cortisol curves? Well, these three things are the bigger ones that are going to help both types of patients, the ones that can't fall asleep at night and the ones that can't stay asleep at night. So these three things I give to everybody. After you wake up, wait 30 to 60 minutes before you eat. You can have water, you can have black coffee, but refrain from anything else. What that's going to do is increase, what all of these are going to do is increase your cortisol in the morning. And the higher we have our cortisol in the morning, the less it's going to be able to spike later in the evening or in the middle of the night. And then as soon as you wake up, we want to actually do a fairly intense workout for 2 to 5 minutes. So it's not going to be a long workout, but we do want to get our heart rate going. Same thing, that is going to increase our cortisol level pretty quickly. We'll have less to spike at other times. And we are going to immediately turn our bright lights on. We want that light to hit our eyes. We want that signal to hit our brain. So that way it's going to start lowering cortisol down, and it's going, and I apologize, I have a very needy cat, so he's on my lap, so he stopped from whining. So I do apologize if I look down or get distracted for a second every once in a while. But we do want to immediately turn bright lights on. We want our body to immediately wake up to that light. All right, so for my patients that can't stay asleep, the supplements that we typically recommend are going to be adaptogens. If you have not heard of those before, adaptogens are typically for the adrenal glands, ashwagandha, rhodiola, and ginseng. They are all known as modulators, and basically it's a very cool thing. What that means is studies have shown that in the body, when we take those, for patients with too high of cortisol levels, it will actually help lower those cortisol levels at the appropriate times. And patients with too low of cortisol levels, let's say they've had acute stress and that's turned into chronic stress and now that's been going on for years, we typically tend to see low amounts of cortisol. Same thing, this will actually help raise those cortisol levels up. So very cool there. CBD oil, typically we'll have a lot of patients take that before they go to bed, but often from patients that aren't able to stay asleep throughout the night, we're going to take that CBD oil when we wake up in the middle of the night in the hopes that we aren't awake for hour, 2 hours, 3 hours. We're going to be awake for 5, 10, 15 minutes, and that's going to start helping put our body back into sleep. Parasympathetics. So parasympathetics, that is our rest and digest part of the nervous system. We also have our sympathetics, which are fight and flight, and more often than not, most of us are spending far too much time in that sympathetic state rather than that parasympathetic, that rest and digest state. So what we want to do is be able to turn that parasympathetic state up higher. That's what the CBD oil is going to do. And some of the other things, I call them the parasympathetic points, is places that we can touch on our body that will actually start activating the parasympathetic system. So, wash your hands before you do this, especially in the middle of the quarantine, but touching your lips will activate your parasympathetic system. It has a calming response on the body. So typically I'll tell patients we're going to spend 1 to 2 minutes just touching our lips and then removing that away, and hopefully that will have turned on that parasympathetic response. The other place is going to be just underneath your rib cage. So you're going to come underneath your rib cage. You can press down into that area lightly, not firmly, just nice and lightly. And typically we're going to go off to the right a little bit more. So just right from center. And we're going to hold there, same thing, for 1 to 2 minutes. And we can do both of those points at the same time. So that will, again, help hopefully turn the parasympathetic system on in the body and help calm everything down. One of the other big things that's very interesting and very cool that we can do to turn our parasympathetic system on is gargle. It activates the vagus nerve, which is a huge parasympathetic part of our body. And by activating that nerve there, we are again going to help relax things and calm things down. Now, if you're waking up in the middle of the night, a lot of my patients don't want to get up and go gargle. And sometimes the act of gargling, because it's an action, will actually wake people up a little bit more. So typically, we're going to save that one for right before we go to bed to make sure that we have our parasympathetic system turned on and ready to go for the night. And for my patients that can't fall asleep, some of this is going to be the same, but rather than the adaptogens, which can be helpful in some cases, These three supplements are typically what I go for. Melatonin, 3 to 5 milligrams. That's typically the dosage we'll see is either a 3 milligram one or a 5 milligram one. Formula 303 or another magnesium supplement. I am a huge fan of Formula 303s. In our office, they're used for sleep, they're used for anxiety, they're used for pain, they're used for relaxation. So a patient brought these in, 10 years ago, and we've been loving it and using it ever since. So that's the picture you see over there. But one of the main ingredients in it is magnesium. It also has valerian and passion flower in it. So those are two other ones that can help calm the body down. And then again, CBD oil, but this time we are going to take it right before going to bed rather than waiting for us to wake up in the middle of the night. And our parasympathetic spots. So once again, that's going to be our lips. That's going to be just under the rib cage, a little bit to the right. All right. And we can gargle as well. Typically, I will tell patients to gargle for about a minute, and you can breathe in between. So you do not have to gargle that whole minute long and try to hold your breath for that long, but we want to spend about a minute of our time focused on that gargling. And for some patients, we will have to work on diet as well. That is another big thing. I didn't include that in this presentation today, but based on our blood sugars, that can absolutely change around our cortisol curve. It can also disrupt other factors of our sleep, and so we will work on diet. One of the big ones is dairy, just because it can activate our certain receptors in the brain that are very excited. And if we are eating enough dairy throughout the day or close enough to bedtime, we can turn those receptors way up. Our brain stays excited, we stay awake, or we wake up in the middle of the night because of that activation. So that's usually one of the first foods we work with and are cautious about if we're having trouble sleeping. All right, so the second thing we're going to talk about today is how to decrease your heartburn symptoms. We have that question all the time. So heartburn is extremely common and it affects about 50% of Americans, with 20% having heartburn on a weekly basis. And one of the things we notice with heartburn is typically when we start taking certain medications, and they are among the most common over-the-counter sold, but once people start taking them, it seems like you're always going to need to take them. Some people, once they start taking them, have to take them daily. Others notice that they're taking it at least once a week, if not more. Why do we have to keep taking this medication? Why can't we get off of it? Why isn't it helping us? Why isn't it actually treating the symptom? So, because, and stick with me here, the problem isn't too much acid, it is too little acid. So if we are treating too little acid by lowering it more, it can be effective for a little while, but it is not going to be our long-term solution. So let's break all of this down a little bit more. This is just one study, but there are many, many studies out there showing that, contrary to popular belief, stomach acid secretions drop the more that we age. So the older we are, the less acid we produce. We can see that when we are, let me put this into red here, ages 11 to 20 over here, okay, our stomach acid is way up here, 175-ish, give or take, on average. All right, and then as we age, this acid declines until we get over to our 60 to 70 age group, and we are all the way down here close to 50. That is a huge decrease in acid. So again, a lot of times we start saying, oh, I have heartburn, I have GERD, I have these different symptoms, and because I have those symptoms, I have too much acid. However, that is very rarely the case. I would say less than 2% of the time is the case too much acid. It is almost always going to be too little acid. All right, so let's break this down even a little bit more. Why is too little acid causing this issue? Well, it has a lot to do with a thing called the lower esophageal sphincter, which is right here. Okay, and that is our esophagus leading into our stomach. Okay, so that esophageal sphincter's whole job is to keep things from the stomach going back into the esophagus. But in order to remain closed, it needs a very low acid, very low pH, or sorry, very high acid, very low pH. We need lots of acid to keep that closed. It uses chemoreception in order to activate it and help it stay closed. And so when it has that high acid in the stomach, that high acid is actually telling that flap, nope, stay shut. We don't want anything going up into the esophagus. All right, so our stomach is typically a pH of 1 to 3, so very acidic. Once it starts getting to about 3 or 4, the activation of that esophageal sphincter is going to be very low. We're going to start having that esophagus open at times we don't want to, and all of a sudden stomach contents are going to start hitting the esophagus. Now, anything with a pH lower than 6, maybe even 7 for some patients, is going to burn that esophagus. So pretty much anything coming from that stomach is going to hurt the esophagus. So we need that to stay closed, and in order to do so, we need a very acidic stomach. Let's see here. So what are some of the symptoms of too little acid? Well, these are really just a few. There's a lot of symptoms of too little acid, but we do get a lot of digestive issues such as stomach bloating, nausea, burping, upset stomach, burning, diarrhea, and we also get a lot of symptoms of mineral deficiency. Because we need acid in order to absorb pretty much all minerals, it is very common for people with too little acids to start having symptoms of mineral deficiencies. So we'll see things like weak, cracked fingernails, dilated capillaries in the cheeks and nose, so we'll see a little bit redder flush there. Acne, iron deficiency, mineral deficiencies. Infections is going to be another big one because having a very acidic stomach will help keep infections from passing into our body, as well as sometimes we'll even get undigested food in our stools. So the big three takeaways here is to remember that acid is needed in order to digest proteins. It is essential for the absorption of minerals and most vitamins, and is very protective against certain pathogens like E. coli, H. pylori. So we do not want to keep lowering and lowering our acid. We actually want to make sure that we have enough acid to help with digestion, help us absorb everything, and to protect from outside infections. So how can we test for low stomach acid? They actually do have a test that you can put a pH capsule down into your stomach, hold it there for a while, pull it back up, and see what that is. But that test is typically around $800 to $1,000, and you have to have very specialized machinery for that. So one of the easiest ways for us to test for low stomach acid is either using lemon water or betaine HCl, which is another word for stomach acid. The lemon water test works well for some people, but not everybody. For patients that have a very acute flare-up of heartburn, or they have had chronic, I mean, we're talking 10, 20, 30 years of heartburn, their esophagus is probably damaged enough that anything acidic is going to hurt. So asking them to use more lemon water, put more acid in that area, is usually going to result in a very bad time. They're going to be in more pain, they're going to hurt more, and for those patients, we want to test it out with actual stomach acid to see if we can get any results. And then obviously stomach acid is a fantastic way just for everyone to test, and typically we'll notice a difference within about a week or two. Often patients start noticing within 3 to 4 days that they are having an easier time waking up and taking either morning supplements or feeling hungry in the morning and being able to eat more in the morning. That's a big sign. And other things that we're going to notice is just better digestion, a little bit more energy sometimes, and those are probably the first things that we're going to notice. Over time, and we're talking 4, 6 months to a year, we will start noticing other differences as well that may have been caused by mineral deficiencies or some other things, but those are going to be the first ones that we notice is better digestion, maybe a little bit better energy, and again in the morning being able to take supplements, being able to eat more food. So again, we want to be careful with some of this. 1 to 2% of patients are going to have reasons that we do not want to be adding more acid in. We want to be very careful with anybody that has ever had an ulcer in the past or who tends to have a cut or anything like that in their esophagus. We're going to be very careful with those patients with how quickly we change this around. Oftentimes we will address food, diet, the gut, and other lifestyle changes we can add in first before we start trying to change stomach acid around. But again, for 98% of patients, it is not going to be too much stomach acids that causing our heartburn issues, our GERD issues. It is going to be too little acid. All right. So again, I'm Dr. Sam over at Live Your Life Integrated Health and Chiropractic. If we have any questions on those, I would love to answer them. This will not stay up forever. We're planning to leave this up probably through the end of May. And then we will start hopefully getting back to our normal, regular, in-person talks. We may be putting up one more video this week, and we will let HTC know about our videos for next week. You guys stay healthy, take care. We will be in touch.